At PSE&G Children's Specialized Hospital, Dr. Sharon Burke examines a month-and-a-half-old infant boy. He's being treated for neonatal abstinence syndrome, or NAS.
That was a term that has been applied to infants born to mothers who were using drugs or on prescription medications of the opioid class during the pregnancy.
When an infant's umbilical cord is cut, that cuts off the flow of drugs the baby was getting from the mother. Withdrawal kicks in anywhere from 24 to 96 hours after a baby's born. Symptoms can vary from gastrointestinal issues, problems eating and breathing. Oftentimes, they're inconsolable.
They may have high blood pressure. Their bodies may get very tight, rigid. Spastic is a term that we use.
The crying goes on for hours. This baby boy was born addicted to prescription pain medication. That high-pitched, gasping for breath scream is just one of the telltale signs.
So what sort of drugs are you seeing babies on here?
Cocaine to heroin to methadone. There isn't a baby here that has one drug in their system. They have 3, 4, 5, 6, 7 different drugs in their system.
So what are some of the typical withdrawal symptoms you tend to see a lot in these babies?
We see a lot of tremors, so their body's shaking. They do a lot of hand wringing and grabbing at their faces, crying and irritable, a real high-pitched cry. Mom was using methamphetamine. Apparently, Mom didn't know she was pregnant, so she didn't have any prenatal care.
As you can see, this baby has no subcutaneous fat, and she was basically starved in the womb.
Clinicians use a scale to grade the degree of withdrawal the babies are going through,
which helps the clinician manage them with the appropriate medications.
The doctors wean the babies off the drug by administering that same class of drug the mother was taking while pregnant.
And take the baby through a titration process every 2 to 3 days of decreasing that drug by 10%. But it's done in a slow and efficient manner so that the baby does not rebound and have worsening withdrawal and or seizures.
This baby boy is now completely detoxed.
He's very engaging, very social. When he first came to us, all he did was cry all the time. We found that we had to give him a lot of medication to help him with through his withdrawal.
He was given methadone for 3.5 weeks.
It's not just enough to treat the babies with medication. You also need to bring in the therapy components.
Babies work with an entire medical team here at PSE&G Children's Specialized Hospital, including feeding therapists to make sure they have the skills needed to feed safely so they don't choke. They spend a lot of time in the pool to relax their muscles, and they work with occupational therapists to ensure they're alert and aware of their surroundings.
We took placement of my son when he was 3 weeks old, and it was just heartbreaking. He faces struggles every day that were completely avoidable.
He constantly wears a smile. That's the first thing you notice about 5-year-old Keegan Connect. He loves Thomas the Train, even though he has a hard time telling his adoptive mom, Jenny.
His communication skills will never be normal. He understands what he's trying to tell you, but we struggle all day long trying to figure out what he's saying, and he gets so frustrated. He was born a 2-pound drug-addicted preemie. He was 8 weeks early. He had experienced 3 weeks of withdrawal. He had been on methadone to get him through the withdrawal symptoms in the hospital.
They're behind from the get-go, if you will.
Ward Rice has worked in the neonatal intensive care unit at St. Elizabeth's Healthcare in Edgewood for 30 years. It's where many babies are born addicted.
In 2013, 12% of our admissions to this neonatal intensive care unit had neonatal abstinence syndrome.
More are expected in 2014. Keegan was behind from the get-go as well.
I think people believe that they're going to get through the withdrawal, the drugs are going to get out of their system, and then they're done worrying about it. But this is never, they're never going to live a normal life. Keegan will never live a normal life.
But Keegan, even with his limitations, will get to live a life with all the help he can get, something Inabinit admits wouldn't have happened if he hadn't been adopted.
Last week, I got in a fight with someone. He hit me first, so I hit him back.
The fact that I got as far as I have without having a breakdown at any point, a really big one. I got really lucky.
Why are you upset?
Go away! When my birth mother drank when I was in her womb, that it affected parts of my brain and all that.
She said that my mom drank alcohol and it damaged my brain.
He usually had to be physically restrained somewhere along the line as he got older because he'd just tear up everything. We were afraid that he was going to hurt somebody as he got older, but you can't let him see the fear because that just makes him stronger and more determined that he's going to do something.
Do you get into trouble a lot?
Sometimes. They arrest me, take me to jail, 3 days.
I worry about Allison as she gets older on her own. Who's gonna be there to tell her right from wrong?
Everything was stacked against this child before she was even born. And the fact that she could scream at 3 o'clock in the morning was a good thing.
I'm sure that something like this can drive a wedge in between a couple, but we have chosen to use this to strengthen us, and it has.
Oh, just that smile. Some of the things she says are just hilarious. She has a great little personality. She constantly keeps us on our toes. She was 19 months old when we first found out about her. We just knew immediately that she was supposed to be ours. She just wasn't keeping up with the other 3-year-olds, and we knew she would have some delays, but they just seemed a little abnormal. So I started asking the pediatrician about it, and he told me everything was fine, but I put her in some therapies on my own, speech and physical therapy, a sensory therapy, and it wasn't until she was 5 that she got diagnosed. She's 10. She struggles socially and academically. She has some great teachers and a great school that help her along. I just think looking at Ashley, most people don't see anything wrong on the outside, so it's real hard for people to understand when she behaves the way she does. People just need to realize that she's struggling on the inside sometimes too.